Hello, class. Now we're moving up to chapter 2 in our introduction to community and public health class. But there are certain things that I want us to really make sure that we have a good understanding of certain concepts or certain issues that were in chapter 1. So I'll spend some time going over some of those things. When you hear health disparities, or health inequalities, it simply means that there are certain groups within populations that have a much better health outcomes than other groups. And in America, in most cases, it's the whites have a better health outcome when compared to African Americans and other minority groups. And but when I say health outcomes, they live healthier and they live longer. And some of those health disparities are characterized by some of these social characteristics. You think of race, ethnicity, gender, location, and socioeconomic status. See, most of the time when you're talking about these inequalities or health disparities, these are some of the factors. And why those certain things really appear inadequate for certain groups. They have less access to health care. And healthcare, everything being normal, it plays a very important role in making sure that one has a good health. And most of the time they live in poor environment. Poor environment, I mean polluted environment. And at times in some situations, polluted water, drinking water, poor sanitation. And in fact, some don't even have tap water, especially in urban areas where you find minorities, some group of minorities. So, and instead of grocery stores, you have convenience stores. And in a grocery store, you go there, you get healthy produce. Convenience stores, most of the time you don't. And you have those situations wherein, yeah, produce are there, but most of the time they are of poor quality. In fact, some studies have shown children that live close to grocery stores, children that live close to convenience stores, most of the time are likely to be obese because of the quality of food products that they buy from these convenience stores. And once a kid starts being obese at early age, there's a lifelong problem for health quality. And at times you have noise, and needless to say, in poor environments or in poor communities, there's hardly any network connections, Wi-Fi, or some of those internet connections that can people can access information. So in a way, they are almost left in the dark. So the gap between these groups, self-dispersed, is also called inequalities in some countries. Now, try to at least understand the definition of health disparity. See, when you say health disparity, try to understand what it means. Now, health disparity have been defined as the difference in health among different population. Some population have great, good overall good quality of health, while others don't. And everything being normal, there is no group that really wants to be in a poor or have poor quality of health. Everybody wants to have a good quality of health, but most of the time, it's the policies, it's the availability of resources, and when you don't have access to good food, good drinking water, good medical facilities, good places to sleep, because most of the time in some of those minorities and homes, you have it's crowded, and all of those things do not contribute to maintaining good quality of health. So that's why I try as best as possible. And in your readings, please take time to make sure that you really spend time to understand these disparities, because most of the time we know that the health of minorities are not good. But at times we also have to know why. Because it's saying, okay, the health minority is not good, it's great, but why? Again, some of these things are, when you think of the resources of this country has enough to provide good environment for almost all its citizens. But it's the willingness of the policymakers, the business community, and just not being willing to share. And most of the time, some of these things are influenced by the racist attitudes. It's because, again, the biggest challenge is the socioeconomic status. Because some Blacks that are fortunate to gain meaningful employment, most of the time move from those dilapidated environments. But a lot more of Blacks cannot, even though they want to. So there has to be policies that can help to address some of these things. It has to be a real commitment. And some of these commitments should really start with with policymakers, legislators, stressed by some of these social workers, highlight some of these deplorable conditions, at times almost shame the system for neglecting some of their populations, and also the religious organizations, the religious body. Because most of the time we talk about this is a Christian community, but some of the attitudes, some of the things, some of the policies might I might find difficult really citing them in the Bible or show where they are written in the Bible. So again, if we want to really be a God-fearing community, we should deal with all, treat everybody the same. Not only observe some values that are really God-fearing and neglect the other values, because there is a lot of poverty among minorities in this country. Okay, now we talk about when what is public health preparedness. As you can see, the coronavirus, COVID-19, has really shown how our public health system is not prepared to be able to handle a pandemic. Resources were not there, and all those things that are needed to making sure that people can respond promptly to preventing people from being sick or protect them against a quick emergencies. We didn't do well as a country, and still trying. We're much better now. But when this pandemic really came to our country, we were not prepared. And as with any disease or disaster, when you don't respond in a timely manner, you allow the disease to fester, enter into the population, and spread. And now we have to spend 10 times as much to address a problem that we could have addressed if only we stayed prepared. Yes, our public system needs a lot of assistance. And part of it is the government also has to play its part. They provide enough resources, provide enough doctors or specialists or public health specialists, and provide enough educational material, common material. And the worst thing that to show how unprepared we were, we had different people coming up with different messages. So it just confused everybody. And when you confuse everybody, you make it worse for minorities. because a lot of minorities suffered and are still suffering immensely because of our poor health and public health system. I hope maybe with the new administration and with the new exposure, because this COVID-19 has really exposed America in a way that I'm sure she's not proud of. So public health preparedness should always be ready to go when something happens, ready to go with the resources, with the manpower, with the expertise, with whatever the right type of information, so that they can prevent um, disease spread, so that they can prevent people from suffering. Because again, this will not be the only pandemic. Somehow it will end. We don't know when, but it will end. But what can we do as a country when the next one comes? Are we going back to the old ways, just looking at things as black and white? Or are we going to say, okay, we need to make sure that we have the manpower, we have the diverse expertise? Because most of the time, diversity is not one against the other. It's just one of those things that helps to speed up whatever process that is needed. When you have a diverse group of people, expertise, who can speak to different populations, who are sensitive to the anxieties of different populations, who know how to explain issues to them so that it can be acceptable. Because right even now, the vaccine situation is becoming a problem, because minorities are just a big concern, because for quite some time, they've gone through hell and back based on the way the group has been treated. So now they are somehow a bit uneasy to really go for this new vaccine. But one thing that I can tell you as my student, please convince your parents, convince relatives, convince whosoever you can to take the vaccination. Do away with the false explanation as to, oh, this guy, Bill Gates has chips in those things so that they can track you. That is rubbish. This is something that can help us live, that can help us stop the spread of this disease. And right now, it's not as easy as it was some years ago, wherein people were not talking. Now we have people who are vouching for minorities. And whenever anything wrong happens, trust me, you will hear about it. And that person will pay for that. So please convince them to take the vaccination. Then the same thing that happened, just as the public health preparedness was not in place, there's also the medical preparedness was not in place. But the medical is when they are prepared, they should be able to quickly respond from health emergencies, particularly those scaled in time. The timing has to be perfect, and those threats that are on predict and the predict predict those um, conditions that could not be predicted, just like what happened. COVID, nobody predicted. So because people were not there who can forecast, who can say, okay, based on what we are dealing with, there is a possibility that X, Y, Z can happen. Let's just prepare, be ready. Because these days, everything being normal, you see, this pandemic, we're having them in a more frequent time than in the past. So the public health and the medical preparedness should always be in place. And when you talk of some of the challenges of the world community, when you talk of public health, some of the challenges include communicable diseases. It's a big one. And COVID-19 is a communicable disease. And you can think of other communicable diseases like typhoid. And most of this, some of these things really start from poor sanitation. Malaria, these are all communicable diseases. So if we improve our sanitation, especially for third world countries, and also some countries, some developed countries, when you talk of the inner cities, I think if the sanitation is improved and you improve the drink safe water, clean water, some of these communicable diseases can be addressed. And yes, there is also the issue of hunger. Some of these climate changes that occur in some areas, you have no rain for quite some time. And when there is no rain, there's hardly any probability for people to have food. So that's a challenge. Or if there's too much rain, it destroys all the crops. So there are a lot of things that are really going on at the global level that still needs response. Even though as a whole, the overall quality of health worldwide has improved because of the vaccinations and some educational opportunities for some of these countries to maintain some level of sanitation, but still there's a problem. Migration, people moving from one country to another in search of freedom or running away from disaster. most of the time, these people live in crowded conditions. It's very easy for them to spread whatever disease might be around. So these are all challenges that I wanted you to understand when you start reading the say chapter one. Make sure you spend some time on some of those issues, because again, you will be the future leaders of this country. Some of you will be the public health specialists or the politicians. Come up with policies that are fair to all, not only policies that are good for one group and to hell with the other groups, because by so doing, nobody will really be healthy. Okay, now let's go to chapter two. The, chapter two, the main focus on chapter two is the organizations that help shape community and public health. See, the work, public community and public health is broad. So to be able to manage those, you have some organization. You need organizations, starting from government to private organizations to quasi organizations that help to promote public health. Okay, here are chapter objectives. After studying this chapter, you should be able to explain the need for organizing to improve community and public health. See, if you don't organize things, usually things, I don't want to say can be done, but it's very, very difficult when things are not done properly. I hate to go back to this present and what we're dealing with. The organization was poorly handled. Explain what a governmental health organization is and give an example of one of each of the following levels. You have the international, national, state, and local. I say most of the time in each government, in each country, you start at the national, the government. From the government, it moves to the state level. From the state level, it moves down to the local level. Explain the role of the World Health Organization. The whole place in community and public health. But as you can see, even when the COVID-19 started, there was a discussion that the World Health Organization either didn't do certain things right, which everything being normal was just false. The World Health Organization, as you can see, is made up of member states. All these member states send representatives at the United Nations. See, the World Health Organization is part of the United Nations. And in most cases, each of the nations should contribute to funding the functions or the activities of the World Health Organization. But in most, as everything being normal, the United States, because of its privileged position, funds most of what goes on in the World Health Organizations. There are some member states, the Western member states, who also contribute, but the United States contributes the most. Briefly describe the structure and function of the United States Department of Health and Human Services. See, all of those, everything starts from the Department of Health and Human Services. And those you talk about, as we will continue with the class, you will see how important that function is. The Department of Health and Human Services, that is the department that is responsible for the health of all Americans. States the three core functions of public health. Okay. List the 10 essential public health services. 7, explain the relationship between a state and local health department. Explain what is meant by the term whole school, whole community, and whole child. Define the term quasi-governmental and explain why some health organizations are classified under this term. List the 4 primary activities of most voluntary health organizations and go down the list. Now, all these objectives are explained as we go on and will be explained as we go on. Now, only in past 100 years have communities taken explicit actions to deal aggressively with health issues continuously. See, in the past, people just do whatever, but in the past 100 years, communities have taken explicit actions to deal aggressively with health issues continuously. Now, part of it is also within the past 100 years, people have known the causes of diseases that affect communities and how those diseases are transferable from one person to another. And some diseases are caused by people's lifestyle. You have communicable diseases and non-communicable diseases. Once researchers, expertise have known, once they now know, okay, somebody has an infection. That infection is either caused by a bacteria or a virus. And they know how that person got that infection. So now there is an aggressive push to make sure that that does not happen. Address the issue at the source. You take care of it before even when you start seeing experience, you take care of it right away so that it does not develop or continues to ravage the community. And also there is that the need for aggressive. A community that is not healthy is not as productive. The quality of life is not that good. And life expectancy is not good. So most of the time, communities get engaged in dealing with some issues based on their own interest. Because if they don't, they have to pay for it. Community response to own problems hindered by various issues. Most of the time, people are almost always defensive. Oh, it's not, it's not. And most of the time, again, even right now, even though, okay, a lot of minorities and other groups are dying disproportionately due to the COVID-19. But when it comes to really dealing with, okay, what is the root cause? What are some of these? Most of the time, the community, most of the time, is not as forthcoming in facing up with their own responsibilities to address some of these situations. Three classifications have been three classifications based on funding sources, responsibilities, and organizational structures. You have government, which is funded by taxpayers. Then you have quasi-government. Quasi mean in between. You have some part of it is funded by government and some part of it is funded by the private sector, like foundations, like philanthropists, some good, people who want to just share their blessings with others. Then you have the non-governmental, some don't get money from government. All they get is through either research or through foundations and through philanthropists. Governmental health agencies. Part of governmental structure is you talk of the federal, the state, or local. When it's government, it's federal. When it's state, it's state. And when it's community, say for instance, federal, most of the time it's DC, headquarters is in DC with these issues. State, what state? Depend in Virginia, in Richmond, or local, Petersburg, local as government. Funded primarily by tax dollars. The government is funded primarily by tax dollars, managed by government officials. So when you look at the governmental part, it's funded primarily by tax dollars, managed by government officials. You have the secretary, from the secretary, deputy, then you have all those other people who manage things. Authority over some geographical area. Again, the country is a big country, 50 states. Most of the time they are divided into some geographical area. One person is responsible for this geographical area, another person is responsible for other geographical areas. They exist at 4 levels. You have the international, which is the World Health Organization. For us, is the Health State Department, the World. Then you have the local, you have the international, the national, the state, and the local. Now you have the DHS. Okay, first you have the international, WHO, the World Health Organization. That is the national, international. Then you have the national. For us is the D, is the Department of Health Services. Then the states, you have the Virginia State and Virginia State Department of Health. Then you have Petersburg, you have the Petersburg County Health System. So it flows, it goes down. International health agencies, the WHO, the World Health Organization, most widely recognized international governmental health organizations. It is headquartered in Geneva, Switzerland. It has 6 regional offices around the world. Not oldest World Health related international agency, but largest. And usually you have the secretary of the World Health Organization. Now this guy is now the Tedros alumnum. He's the director of the World Health Organizations, speaking at the end of the year press conference at the World Health Quarters in Geneva, Switzerland. The history of the World Health Organization. In 1945, the Charter of the United Nations article calling for establishment of health agencies with wide powers. In 1946, United Nations representative created and ratified the Constitution of the World Health Organization. In 1948, Constitution went into force and World Health Organization began work. See, some of these things you might think, oh, they've been around for so long, you know. It's just started. And some of these things started just after the Second World War. See, a lot of international relationships or interactions got better from lessons learned from World War II. United Nations was established, and at the United Nations, there is where they solve world problems. You have each country, each member state have their own representative. So when they have issues, they bring those issues to the big body. The United Nations office is in New York, where they meet and discuss issues and see how best those issues can be resolved to prevent them from getting bigger and eventually lead to another war. Because the destruction of the Second World War was enough to put some sense into some politicians or some political leaders to know that violence is not the best way to resolve conflict. People come together, discuss, and find better ways to resolve conflict, not through violence. So, and also knowing that people have health related issues, the need for the World Health Organization to be formed was very important. And it has greatly helped to improve the health of all nations. Some nations have really experienced more improvement, and others are slowly getting there. But overall, the World Health Organization as a body is very, very, very helpful to the overall health of the world. And one of the things that people have come to realize is this idea of, oh, it's just our country. We have enough money to take care of ourselves, forget about the rest of the world, which is one of the dumbest things that some leaders at times tend to engage in, not knowing that the world is interconnected. We are all interconnected. You don't solve a problem there today, give yourself some time, that problem will be under your feet. So it's better for those with the resources to do the best that they can to continue to fund these organizations, to work with them for the betterment of the human race. Membership opens to any nation that has ratified constitutions and received majority votes of World Health Assembly. World Health Assembly, delegates of member nations. They approve World Health programs and budget. There are 194 member countries. World Health organizations administered by different levels of staff. Now, the purpose and work of World Health Organization. Primary objective, the attainment of the highest possible level of health by all people. That is their primary objective, the attainment of the health of all people. 6 core functions to achieve objective. Now, the work financed by member nations. Most notable work helping to eradicate smallpox, because that was a killer. when I was growing up in Africa, I saw people dying, people of my age group dying. So luckily now it has been eradicated in most parts, if not all. Again, people came together, develop a vaccine, and that vaccine has helped to put an end to this destructive disease. Work guided by 12 general program of work and the UN's Millennium Declaration. 203, 23 Millennium Summit established Millennium Development Goals. Sustainable Development Goals established in 2015 to build on the Millennium Development Goals. These are some of these selected achievements found in the Millennium Development Goals. Now read some of this. Because of the World Health Organizations and some of their members, they've been able to address some of these situations. Extreme poverty has declined significantly over the last 2 decades. Primary school net enrollment, again, the need for education. Many more girls are now in school. This has been a challenge for developing countries. They only allow boys to go to school, but are not girls. Thank God that has changed, and now boys and girls are now going to school. The global under 5 mortality rate has declined, which is also a good. New HIV infections fell by approximately 40%. See, now the ozone depleting substance has been virtually eliminated. Official development assistance from developed countries increased by 66%. So again, collectively, some of these things have not been as easy, especially when you talk of developed countries. But there are various branches within the World Health Organization that fights for some of these things that I've just recited. You see, because again, in some, you need to provide opportunities for some people to really develop stable governments. Because most of the time, most countries have enough resources, but unfortunately, they don't have stable governments. And they don't have governments that really have the interests of their people. So they use the resources of their respective nations for their own good. That is one of the biggest challenges in most countries in Africa. Now, going to school, you have governments, some missionary groups, and some other groups have gone to certain parts of the world to open schools. Because again, an educated population has a better chance of being healthy than a non-educated population. And when a girl is educated, you have a healthy family because women everywhere, in most cases, in fact, everywhere, takes care of the family. And when you have an educated woman, she knows how to take care of the family. And infant mortality rates have decreased because now we have better food, vaccinations, people know more as to prevent certain conditions that can impact the health of the child, and also have improved also in developing some sanitation. The sanitation has gotten better. You have vaccinations, and people also are doing the best to 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 improve their overall quality of health, and also food, because most of the time, hunger has to be another issue. So when there is enough food, people will grow healthy. And also the infection, HIV infection, has continued to decline because now there are better medications, and also people have known, the information is there, how to prevent yourself from contracting the disease. Even though that information, you still have some people who still take risk. The ozone depletion, that is also something good. And official development assistance from developed countries increased by 66% in real terms between 20, okay, 20,000 from 2000 and 2014, reaching $135.2 billion. So going back to the value of the United Nations, the World Health Organizations, and all those other branches, because it's not only health that is, you have those for health, those for education, those for improve poverty, those for, there are various branches within within the. Now, our next class is going to start from here, 17 sus- sus- sustainable development goals. Now, this, for some countries, that's already been achieved. For others, it's still in the way. But take time to read those things. Read some of this, even though the next class I'll go over them and explain as I go along. So you take care and stay warm and stay safe.